You're watching TV9 Digital. I am Adarsh. What is it that is causing mucormycosis in COVID-19 patients? To start with, it is the reduced immunity due to COVID-19 that paves the way for the entry of mucormycosis into the system. Doctors and health experts have been citing diabetes, dialysis for renal failure, or steroids administered to COVID-19 patients during the course of treatment as some of the possible reasons. However, European countries have rejected the steroids theory. Another reason that is being suggested is the use of contaminated water in some instances for producing oxygen and then giving that oxygen to patients. Fungal spores found in soil and organic matter, usually inhaled by humans from the air, is also said to lead to mucormycosis. Patients on immunosuppressants, patients with excess iron, trauma, burns and malnourished people are all said to be susceptible to this particular infection. So is it possible to pinpoint one main reason for mucormycosis? To answer this very question, the Department of Medical and Family Welfare will constitute a multidisciplinary research team comprising 10 experts drawn from various branches of medicine. On the other hand, in what may be viewed as a positive update, the number of cases of mucormycosis in Delhi are set to decrease in the next few days owing to a decrease in COVID-19 cases in the city. So, will a similar trend be observed in the rest of the country? I had a word with Dr Sitesh Roy, clinical immunologist from Mumbai, on the reasons for mucormycosis and what next. I asked him, given the diverse set of reasons that are being cited for mucormycosis, can we pinpoint one reason? And apart from the ones that are already being cited, could there be more reasons?
Mucormycosis is what is called an opportunistic fungal infection, and there are clearly multiple reasons why this can occur. While it may be easy for the Europeans to say that the steroid theory can be dismissed, they have no idea when pulse steroids at doses of 3 times of normal are given to a patient, as well as the patient's blood sugars are shooting up to 400 and 500, what that can do to their immunity and make them prone to getting these kind of infections is very, very obvious and clear. It grows, this fungus grows in soil, in water, in garbage and contaminated areas, dead vegetation. So there are many sources to get this fungus into our respiratory tract, as it's a common part of our environment. And it's only a matter whether the person's immunity, because of a severe bout of COVID or a moderate bout of COVID, is already suppressed and unable to fight off this commensal infection, is when we end up with a mucormycosis infection. So clearly there are multiple factors to this, the main being a depressed or suppressed immunity.
Now, given that mucormycosis is an infection that has existed in the past as well, should we be worried about it, and how much? Yes, the number of cases are rising in some parts of the country, but the infection isn't new. How can we better calibrate our response from what we already know?
Definitely in the post-COVID era, the number of cases of mucormycosis that we are seeing is significantly higher than we would see in a routine day-to-day ENT or ophthalmological or other practice or pulmonary practice. This is due to, as I mentioned, multiple reasons, and the main factor that we can change in all of this is removing the fear that is associated with it and recognizing the disease early, seeking medical advice and care at the earliest, obtaining the right investigations like CT scan of the sinuses or wherever the affected organ is in the body, obtaining the right kind of fungal cultures in a timely manner, and beginning the antifungal medications and supportive care, and when needed, surgical intervention at the earliest, and we can certainly save lives, save vision, and make a lot of difference to these patients. So I think a balanced, reasonable, timely medical response with a high level of suspicion so that we pick up the cases early is what is really important at this time.
Now, with the cases of COVID-19, which is the primary disease, decreasing, can we expect a decrease in the cases of mucormycosis, which is a secondary disease in this case, in line with what is being observed in Delhi? And also, what would you suggest to those who have recovered from COVID-19?
Most certainly, as the cases of COVID-19 reduce, the cases of severe or moderate to severe COVID-19 will also reduce. The number of people who have required steroids, heavy antibiotics, both of which predispose to this fungal infection, will also reduce, so we can expect the numbers to come down for sure. For anyone who has recovered from moderate to severe COVID and has been on multiple antibiotics, which by itself is an inappropriate practice, or high doses of steroids, they need to be vigilant about the signs and symptoms of mucormycosis: sudden facial pain, discomfort, unusual dark colored or different discharge, bleeding from the nose, disfiguration in the face, nose, eyes, any of these areas, sudden headaches. Any symptoms that point to mucormycosis should be evaluated at the earliest time point, and appropriate medical care should be taken, and then we can certainly prevent the bad consequences from this disease. Careful management of blood sugars is another very, very important piece for managing the post-COVID recovered patients.
If you like the information that I've brought to you, make sure you like and share this video, and yes, subscribe to TV9 News on YouTube, Facebook, Instagram and Twitter. Until next time.